Queenslanders are being told to take all necessary precautions to avoid COVID-19 super spreader events as the festive season fast approaches. It's feared the state's health system may not be able to cope with an influx of cases as many major hospitals are paralysed by bed shortages.
Queensland's COVID-19 public health emergency is technically over, but experts warn the virus is still a threat.
Despite all those measures being relaxed, COVID is not over.
Pandemic powers given to the Chief Health Officer have expired as of Monday, meaning he can no longer close the state's borders or order lockdowns. Instead, Queensland has adopted a new COVID-19 traffic light system. Red means wear a mask indoors, amber, wear a mask in some settings like public transport or around vulnerable people, and green, which is the current tier, stay home if unwell. As two new variants, XBB and BQ, reach Australian shores, some experts believe we're at the beginning of a new wave. With that in mind,
I would have preferred us to start in amber rather than green because, we do have these new subvariants emerging. Our booster rate is well below where I think it should be. And, it's clear that the pandemic is not over. And I think, unfortunately, the green light has sent that message to at least some in our community that the pandemic is done. And it's just not the case.
The state government disagrees.
Obviously, we're concerned about any illness. What we have right now is a very, very low level of COVID.
Just over 100 COVID patients are being treated in public and private hospitals across the state, which is historically low since border closures were lifted. But that's little comfort to some who say more should be done to boost our health system while COVID-related demand is weak.
It is concerning that our level of preparedness hasn't really been addressed over the course of this pandemic, and we continue to struggle in our healthcare system essentially at baseline. So we don't really have a lot of capacity to handle surges from any reason, including COVID. And so, I think this would be a good time as we, are in a relatively lower risk period to maybe address some of that preparedness to, get our healthcare workforce vaccinated, for example, to see where we can best apply our resources so we are prepared for when COVID cases do go up again.
Bed shortage plans have been activated at several major hospitals this week. Royal Brisbane and Women's Hospital, Townsville University, Cairns and Mackay Base hospitals are all at their highest tier, meaning there's limited capacity to meet the needs of the local community.
But of course, as we all know, the health system continues to battle to recover from the impacts of those big waves, and that will continue while we also prepare to see more cases of this and more cases of other viruses that circulate within our community.
Latest data shows about 4,500 Queenslanders are currently infected with COVID. Lucy Gray, Sky News Gold Coast.